So the lifestyle medicine, tell us about it, because I feel like truly that's what keeps you out of the hospital.
Well, it is, and a lot of people are always surprised when we talk about, lifestyle medicine and take care of yourself. Like I'm
What does
not
that
I'm not
mean?
quite there yet, but there are
Yeah.
people that say if you have to go to the hospital, that's a failure in your healthcare system. You
Yes.
shouldn't have to go to the hospital.
No.
Obviously, if you're in a car wreck,
Yeah.
if you're having a baby, there are certain instances where you plan to go, but if you have something happen that's unplanned and you go to like somewhere along the way there was a failure in the system because you should be taking care of yourself to where you don't have to go to the hospital, hopefully.
Hi, my name is Jessica McCoy, and I'm your host here at Raising Midland, a podcast for Permian parents. I'm here today with Mr. Stephen Bowerman, who's the president of Midland Memorial Hospital and also the CEO. Join me as I welcome my friend Steve. Go
Thanks
by
for having
Steve or
me.
Steven.
Steven, it's fine. Yeah.
That's great. Well, awesome. Thanks for coming today.
Yeah, thanks
You're
for
a
having me
busy
on.
guy.
I am. I like it. I like to be busy.
I bet. I can't imagine being the president and the CEO of Midland Memorial Hospital. I bet you were just everywhere and just learning all different sorts of things all day long.
Yeah, well, yeah, you can't do it alone. I've got a really good team around me, a strong executive staff and directors, and we have a strong medical staff and an engaged board. So I'm not alone in this. I carry a lot on my shoulders, but so does everybody else on the team, and we divide and conquer a lot.
That's awesome.
We certainly want to advance the healthcare in Midland.
I don't even know the first thing about how to get into working for a hospital, let alone managing one. So
Yeah.
how did your career start?
It's
Where are you from?
I'll try to be short with it because it is a winding path of how I did not seek out a job in healthcare. I was not looking for that. I'm from Kermit, which is a small town about an hour west of here. Grew up there, graduated high school in '95. Went to West Texas State, now West Texas A&M in Canyon, and got my undergrad degree. And then I graduated in August of '99 and moved back to Midland in August of '99. So I've lived here for over 25 years. Married my high school sweetheart, and we've lived here ever since. Have two boys. Have a 20-year-old Dylan who's a junior at Texas Tech, and then we have a junior Jack at Legacy High School. So yeah, so this is home for us. It's my mother-in-law lives here. My parents still live close. Both my sisters live close. So this is home for us. But when we graduated and moved back, Monica, my wife, found a job in about 3 days. And I interviewed probably 10 places and I could not get a job. Well, you don't have any experience. You haven't done this, you haven't done that. And my degree was in business management, but I had done a lot of IT work while I was in college for the local school district in Canyon. And so there was an IT job open at Medical Center Hospital in Odessa, and I applied for that job and I got that job. So I worked at Medical Center for about 6 years. I was in the IT department for a couple of years. I moved into accounting for several years. And then I moved to Odessa Regional Medical Center and as the controller, the head of the accounting department. And while I was there, shortly after I got there, they bought Alliance Hospital, which was a different hospital located right across the street. It's one hospital now, Odessa Regional Medical Center. And they promoted the CFO to another position, and I got promoted to chief financial officer. So I spent a couple of years kind of pulling those two hospitals together. Is a great place to learn. It's a for-profit healthcare system at Odessa Regional. Is a great place to learn. Stacy Brown's the CEO there. She was the CFO that hired me and became the CEO. We're still very good friends. But it is a great place to learn how to be a hospital administrator. But I knew it wasn't long-term for me, just a different mission. And then a mutual friend, connected me with Russell Myers, who I know that you've met and known, and he hired me to be the chief financial officer here. I started in February of '09 and served in that capacity with varying responsibilities. And then he exited that role in April of '23, and I was promoted by the board to be the president and CEO of Midland Health, it's crazy when you say it out loud because I had no intention to land in healthcare. I wasn't passionate. I could not do what our nurses do. I'm not capable. I'm so inspired by our clinical staff every day and the work that they do. I'm not capable of doing that kind of work. So I feel like I'm there to support them and make sure they have the tools they need to do their jobs and try to get them what they need. Because I'm not capable of doing that kind of work, but I really love it. I feel like the work matters. I work with inspiring people. The community cares about healthcare. Sometimes they're happy with us, sometimes they're not, but it just means that the work we're doing is meaningful and it's important and it touches a lot of people. And so I love it. I can't imagine doing anything else.
I just think that's amazing. I think we were talking before we started today, the how so many Midlanders end up here doing things that they didn't think they were going to be able to do, let alone wasn't even in their trajectory of life,
Yeah.
you know?
Yeah, it was not my intention to end up back in West Texas when I was graduating from high school, but this place has a certain pull.
My husband calls it a tornado, or not a tornado, a vacuum.
Yeah, it
And
just
it
pulls you
just
back
sucks
in.
you back in, you know. And I feel like it's so interesting, especially if you just hold. I don't know. I'm sure you were like this in high school. You're probably like, okay, this is what I'm going to do. I'm
Mm,
going to do, X, Y, and Z. This is what I think I'm going to do with my life. And then life actually happens to you.
yeah,
And then you look at the trajectory of your life as you get into it,
yeah,
and you're like, wow, this really did just go ebb and flow
yeah,
as things changed in my life.
yeah.
That's
It
wonderful.
certainly makes you know that God has a plan. You're not in complete control because this is not what I would have picked, but I was led. I followed the path laid out in front of me, and it led me here, and I'm really happy with it. Yeah, that's right.
That's very cool.
Yeah.
Awesome. So personally, I have had both my kids here in Midland, and being from a big city, I have actually, and I said this to your ER director, Dana Taylor,
Mhm.
and her and I hit it off really well the other day. I was actually hospitalized the day before I called you.
Oh,
Yes.
that's why you called.
Yes, I know. I'd be like, "Hey, sir." No, I'm just kidding. But, I had a great experience at the ER, and, I have a couple medical conditions myself. Being adopted, it feels like a jigsaw puzzle of trying to figure out what was going on, but I had the stomach flu, and, I experienced some of the best healthcare just in general, and I've been to a lot of ERs before just because of what I have to get checked, and I was telling her just how I felt as a patient being there with kind of a complex medical history. So, talk about that. What does the ER do really well?
Yeah, the
We'll
ER
break it
does.
down a
Yeah,
couple through the different
I
departments.
mean, it is an emergency room, and so there is no, if we're going to talk about women's and children's services later, we'll talk about our imaging center where we do mammograms. The people in there have a pretty good idea of what's going to walk through their door every day. There's certainly a range and different complexities, but in the emergency room, you get everything from I had the sniffles to I have a stomach flu to I fell and I hit my head to major traumatic trauma and car wrecks. The nurses, the clinicians, the physicians, you never know what's walking through your door every day. So, and I think that's what draws those people
I was
to
just about to
that.
say
Yeah, I mean,
that
they're a special.
ER
Uh,
doctors are always like
yeah,
just ready.
they love it, and
Adrenaline seekers.
yeah,
That's the word I was trying to
it,
find.
it definitely is a rush, not knowing what's going to happen, and you know, so there's a calling for that kind of work for all the different works. There are people that are called to take care of sick babies. I mean, I cannot imagine doing that work every day. It just has to be so stressful and high anxiety but there are people that go to the ER and they want that excitement. They certainly don't want bad things to happen to people, but they like the challenge of saying, "Bring me somebody that's really injured, and I'm going to take care of them. I'm going to fix them." And I think we'll talk about this a lot in all of our discussion. The difference maker in our organization, and I think for our community, is our people. Right? It's go. If you've been in our ER, you've seen our staff at work. You've met Dana. You know some physicians in the community. You walk away from talking to them, and you're like, "There's nothing we can't do. Like we may need money, we may need space, we may need some new equipment, but why can't we do that? If they can do that in Lubbock or they can do it in Dallas, we can do it here too."
We'll circle back on that too,
Yeah.
because our conversation that we had with Russell Myers, who will air actually after this episode, was very interesting. He was saying that the planning and development of the hospital, it was the way that you guys did it, I really appreciated because I'm more of a top-down thinker. And he said when you guys were planning for the NICU, it was more of a 10-year out thing. And you're like, man, this is something that we have to get going on. And as the funding cap happened and as the community raised concerns about what they needed,
Mhm.
that was something that was already in the works and was already planned for in regards to the blueprint of the
Yep.
hospital. So I really think that forethought is so unique and does not happen like traditionally. Like I'm in the process of building my own like building for my business, and I'm consistently thinking, okay, well, what can I do? How am I setting myself up for the future? So on that note, let's talk about the NICU. It was in the dream and in the works decades before it even
Mhm.
happened, but there was something that sparked it where it really got the community involved. So can you talk about
Yeah,
that
yeah,
whole
I'd love to. It's
process?
one of my favorite stories, and So when we approved the tower, I got here, I started my job at Midland Memorial in February of '09. And at that point when I started, the directors had already called the election for it to pass a general obligation bond, which is paid for by tax money,
Mhm,
to generate, I think it's $115 million in bonds to build the new patient
mhm,
tower, which included a shelled space for the NICU. We didn't think we needed a NICU back in '08, '09 when this discussion was happening, but Russell and our board had the foresight to say, let's make a space for that. And maybe we need it someday. And if we don't need it someday, we can make an additional L&D room. We'll use it for something. And that's the foresight of our board. I've experienced it with the project we have going on right now. But coming from Odessa Regional, which that's really their bread and butter, is
they have a great NICU.
they have great physicians. It's a
Mhm,
fantastic
mhm.
hospital. There's no doubt. But that before they bought Alliance, it was Odessa Regional Hospital, and really that was the bread and that was all they did. It's women's and children's services. They did surgeries for some things. But when they bought Alliance, they picked up cardiac and orthopedic work, and so they really expanded their service lines. But the NICU was their bread and butter. Dr. Sanjay Patel was their longtime medical director. I think he's still there. I knew him when I was over there. I didn't have either of my kids in Midland. Both of my kids were born when I was working at the two hospitals in Odessa, and that's where they were born. So,
Yeah, wouldn't that be sacrilege if, like,
yeah. I got to
you
experience
gotta
both of them, but
yeah.
not Midland. So
Oh, that's
that's
funny.
that's unfortunate. But so our board had the foresight and said, maybe it's not the time today, but let's plan for it. And so when I came over, having that experience with the service line on the finance side anyway, and there was data becomes better and better all the time, but we had
Mhm,
some data and we couldn't support it. We said, I
mhm,
don't think there's enough volume here. There's certainly people that live in Midland that are having babies born that need a NICU, but there's just not very many.
mhm.
And when we got into 2018, 16, 17, 18, we started refreshing that data. And what we had identified about is, I think it was early 18, whenever we said, hey, we need to do this. I ran some market share data, and there were 700 women that lived in Midland County that were having their babies somewhere else.
Wow.
And we have great physicians. We had the brand new tower was open. We really had a first class space. The only thing we could determine is these people are leaving, and not all 700 needed a NICU, but they feared they may need a NICU, and they thought, if I have a baby, I don't want to be told, hey, you're going to recover here. We're getting an ambulance for your baby. We're going to take them to Lubbock or Dallas or Odessa, wherever it is. And I understand as a parent to say, I think I'll just go somewhere where if that happens, I'm there. I'm right down the hall. And so we talked to our board, we talked to our foundation, and we said, there's 700 deliveries. We're the only healthcare provider in Midland, the only fully acute care system we're failing our people if they're having to leave. 700 women leave here because don't feel it's safe to have their baby just in case.
So let's talk about that, because that's honestly the reason why I came to Ryan, my producer, about this idea to create this podcast. Just because our perceptions are there doesn't mean that they're accurate, right? So I'm going to be honest with you. My first son, he was failure to thrive.
Okay.
So I was like, measuring small, he was small, and I have a blood clotting disorder.
Okay.
So that's part of the reason why I have so many issues in the ER. And so what that means is I have to take shots twice a day
Okay.
the entire pregnancy. Well, sorry, once a day for the first part, and then twice a day the second trimester, and then after the postpartum period. So, like, it's really a whole year on Lovenox, which takes a toll on your body. And I mean, we had to talk with my OB, who's a good friend of mine, and we were talking about, okay, well, what do we do? What happens if he is failure to thrive, which means he stopped growing, and we were having issues with the pressures of his umbilical cord. And to me, my husband's an engineer, and I am not an engineer. I'm the opposite of an engineer, but I am pragmatic enough to say, what's going to happen because when you're on a blood thinner, things can go really bad
Sure.
very, very quickly. So we're thinking, what level ER is this? What level pediatric ER is this? Do they have pediatricians available? Obviously, we have a great pediatrician, but what if we needed a higher level of care? What did that look like? I mean, we went so far into looking into my husband's medical insurance through his company on what level of a helicopter we would be able to use, because most insurance companies, being in the oil field, will allow you to use the helicopter services to EMS your child out of
Yeah.
Midland. A lot of people don't know that. I know that because of Blue Cross Blue Shield, the hours long conversations that I had to have with them. These are situations when you're 32 weeks pregnant. first baby,
You're a
first
planner.
off, you have no idea what you're doing when no offense to first time moms, but like when you have your second or if you choose to stop at one, um, you don't know what is going on because it's your first time doing it, right? So I was terrified because I was thinking, man, I'm in no offense, at the time I had no idea, but I was like, man, I'm in the middle of Midland.
Middle of nowhere.
Yeah, and I'm from, Houston, Austin. I don't know what to call myself. I went to school in Dallas. Like I didn't know.
Mm.
So my preconceived notion was that it was bad. And that's something that I really am trying to challenge with these conversations is just because you have a preconceived notion about something doesn't necessarily mean that the reality is negative. Because I was very surprised. I didn't know at the time, and it wasn't until the hospital reached out to me because they said, "We know that you're coming in for an induction. We know that this is going to be a serious like situation. Here's what we have planned. We've already talked to your OB. Also, starting at 32 weeks, you're going to start going to the neonatologist. Say that 5 times through. That building that is next to the
Yeah.
West Texas
Not the
Food Bank.
neonatologist, it's the maternal fetal medicine doctor,
Yes.
the high level OB to
Yes.
prepare. He'll
Exactly.
be in the room with your OB when you deliver just in case.
Exactly.
Yes.
And
yes.
what I
Dr.
did.
Anokpane.
Yes.
Yes.
Oh my gosh. Best
Yeah.
experience
He's
ever.
in the Craddock office building connected to the hospital.
Exactly.
Yes.
So what I didn't know, I didn't, for one thing, I didn't know he was available. I
Mhm.
didn't know that was a thing. Because in my head, I'm having a baby. I'm having so many people call me now because they're like, this is plan A, this is plan B, and this is plan C. And I'm like, I haven't even like figured out names like fully yet. Like, and I'm a pretty type A person. So it was very overwhelming. But the entire process was steered by the hospital because y'all were saying, we have the solution. I just really appreciated the forward thinking thought process of patient care. Because I've had really bad patient care at other hospitals in larger cities. And this was the most thorough OB experience I've ever had. And I've had a second child since then, and everything was gravy with that.
Yeah.
So
Well-
I got to see both sides. I got to see the specialized care, and I also got to see what a typical pregnancy would look like. So, can you explain what resources are available for mothers who might be in a situation where they might need the NICU or additional prenatal care?
Yeah, I can talk about some of the things we have. Certainly, you mentioned your OB. I don't know who it is. Somebody I'm sure that I know, and we have a great team of OBs here at Midland Women's Clinic. We have some individual providers. Texas Tech has a program here. They're available, and they staff our labor and delivery unit 24/7. So if somebody comes in unattended and is ready to have a baby unexpectedly, if your physician can't get there for whatever reason,
Wow.
we have somebody always available that is an L&D doctor,
I didn't know that.
OBGYN, that'll deliver your baby for you. Yeah.
Wow.
Laborist kind of program is what it's typically called, but we use tech for that, and they do great work. So we have a broad range, and that is probably the introduction to healthcare, right? It doesn't start with the hospital. Hopefully you never have to come to the hospital. If you're having a baby, probably. We have a great birthing center here with Courtney that
I love
has opened
Courtney.
recently, and she's very passionate about it. And the hospital's very supportive of that stuff. If that's what a woman wants, I'm so glad that she offers that as a setting for that kind of service for women that want that, because you can't exactly deliver it that way at the hospital. We try to
I will say I was very surprised because Courtney, what Mr. Bowerman is talking about is Courtney Luma, who owns the birth center of Midland and the birth center of Odessa as well. I actually
certified midwife here.
exactly
Yeah.
certified midwife. She's also a registered nurse, and she has a lot of experience. I was actually hired them to be my doula, and they were explaining to me exactly what the hospital will allow you to do. For any mothers that are interested, they will allow you guys to walk around as you labor. You're also allowed to use a peanut ball and other different types of birthing strategies. They did not once tell me no to any of the things that I came up with my doula.
Good.
And I really appreciated that. And I think that there's a collaboration because Courtney and Jenny Townsend, who was my doula at the time, they really set expectations to say, this is what is actually safe for you in this environment. And this is what the hospital is going to be able to collaborate with us in the different capacities that we needed them.
Well, good. I'm glad to hear that. I think Courtney and our group has come a long way together. We've allowed midwives on our staff at the hospital for as long as I can remember, but we didn't have any. So Courtney was kind of a trailblazer, and you know, we are a hospital and we're
Mhm.
licensed by the state, and
Mhm.
we have a certification from
Right.
CMS, Centers for Medicare. So there are certain things we don't have a lot of wiggle room on, and I think we've found our way around that. Now her birthing center is available
Mhm.
for people that want to deliver there, but some people are still like, can we do it at the hospital just in case? The
Right,
same
like
thing.
me.
Yeah,
Like, I wanted a hybrid of
I want
both.
that experience, but I want to know that I have all these resources available if something bad happens. And so, yeah, Courtney's does a great. She's extremely passionate about patient care and patient choice. And you know, I think we've come a long way. We certainly respect that. I do. I want a patient to be able to have the experience that they want to have. But there are certain things in the hospital we have to do, or we'll get in a lot of
Right.
trouble if we don't do them. So we do well. But that's your first entry into the healthcare system is probably your doctor.
Mhm.
Hopefully it's not the ER that you've got care, you've been seeing somebody. But you know, without going into a lot of detail, you can go to our website,
Yeah.
midlandhealth.org, but we have childbirth classes, we have
Mhm.
breastfeeding classes, we have sibling classes
Mhm.
for a new baby coming into a family. I have two kids, and it was a eye opener for
I
my
did not know
oldest.
that,
Yeah.
truly. I feel like my son could have probably benefited from that because, like,
Yes.
being the firstborn boy in the entire family,
Yeah.
like,
He's the apple of everybody's eye, and then this
yes.
new entrant
They're like,
comes
"Who's
into the
this
family.
person?"
Yes,
I
what is
know.
going on here? So we offer a lot of those kinds of things, and I'm glad that our staff reached out to you and hopefully provided some relief. I bet it was overwhelming, but like we're ready.
But I
We
felt
have things.
there's something to be said about someone who is medically complex like myself, who's also seeing the normality of what birth can be. It it feels like a lot of information, and oftentimes I know I talk to parents about this as well, is you're looking for that one lighthouse doctor or like that one lighthouse person in your life
They
that
just connect with you.
yeah,
Yes.
that's just not like frazzled. And every single person that I interacted with at the hospital was that type of person for me. And I just really appreciated that. And this is not, I always tell people, that this podcast is not supposed to be fluff pieces for everybody that we're on here. It's meant to have challenging conversations and actually talk about positive and also address challenges as well. So I hope when y'all are listening, you're hearing me out from my own story because I can only talk about what I'm
Yeah.
comfortable and what I've gone through.
Yeah.
So on that note, I'm also thinking when you're a woman, you said the first part of your experience with the hospital will usually be through having a baby or, sometimes going to the ER. What about later on in life? I know that the hospital, let's talk midlife,
Yeah.
right? You're talking about perimenopause and menopause. What type of services does the hospital offer for women who might be at higher risk for breast cancer and other different types of cancers at
Yeah.
this time in their life?
I'm glad you hit on that. That's one of our certainly a proud service line for us, and we've come a long way. And I'll talk a little bit about Russell in this because I was there with him, but he kind of redeveloped what we do in breast care at Midland Health because he had an employee who experienced something and came to him and said, "Why did this is not the way this should have worked?" And Russell was like, "You're right, and we'll fix it." So we own the Texas Surgical Center out by the stadium,
Mhm.
and right next to that is our Legends Park office building. We have a partnership on the surgery center. We don't own all of it. We partner with some physicians and another company on it. But when we bought the surgery center, bought into that, we bought the land next door and we built the Legends Park office building. So it's a two-story office building, and on the first floor there is the mammography
Mhm.
department. We have an MRI. We do ultrasound over there. It's a first class place. So we had mammo that was located at our F. Murray Hall Outpatient Center before
Mhm.
we built that. It was a nice setting, but we know that women are the healthcare decision makers in the community, right? They decide for the family. Here's what we're going to do,
Mhm.
as you just talked about in your experience getting ready to have your baby. So we wanted to provide a first class location to provide that service. We do over 1,000 mammograms every month. So we
Wow.
did 13,677, I think is the number. I have a few numbers I memorized before I got here. That's a big number. And so we do a lot. We have two 3D units. We have the ultrasound and the ABUS, which is the advanced breast ultrasound unit that does the 3D imaging. Uh, I'm I'm really
I'm
out of
so
my
so
depth
no, but, like, I'm, like,
talking
so
about this.
impressed, though,
Yeah.
because acronyms, I can never remember any of them. That's amazing. My mother-in-law is actually a breast cancer survivor, and she got her treatment at MD Anderson,
Mm.
and every single year she has to go to MD Anderson, but she told me that she did her latest scans this last year here, and she was so impressed. She said, like, I guess some of the, if I remember this correctly, sorry, Jane, I know she's going to probably listen to this. But if I remember correctly, she was saying that it's equal to that of what MD Anderson has for imaging. That's incredible.
I think, certainly we don't provide the same level of cancer
Right.
care that MD Anderson
But
does,
like, that's
but we do.
impressive.
It's again, it's a lot of philanthropy. We've had help from others. Our radiologists are very involved in the equipment that we have, so we do have first class equipment.
I
It's
just,
one of those things like we can do that here.
right. Well, what I didn't understand is the this, I mean, I guess I could appreciate it going from what I've experienced with the hospital, but what I didn't understand is how much collaboration there is between hospitals. So she was saying that her physicians in MD Anderson could easily communicate with Midland Memorial if they needed anything, and she could continue her care in some capacity here.
Mhm.
And it's my understanding that that is very common. I did not realize that there was that level of communication because, for example, for myself, my hematologist is at Texas Presbyterian in Dallas, and Dr. Modi does not like to talk to hematologists
Anywhere
other
else?
than himself.
Yeah.
And I love him dearly, and he's a
Yeah.
great doctor. But, there came a point where I was like, if I can't facilitate as a patient, I mean, that's too much for someone to handle as a patient. I don't want to have to babysit a doctor in another complete different city. I want to be able to receive care at my hospital and then have some level of collaboration. So, can you speak upon that? Like, how do you, as the president and CEO of the hospital, facilitate and encourage your physicians to have a collaborative environment?
Yeah, it can be hard with some specialties. Others we find that they come out of school and that's the way they learn. That's the way their residency went. So they're prepared and they expect to have technology in place to be able to have interactions with physicians in Dallas and Houston or wherever it might
Hmm.
be, or to be able to provide that same kind of level of experience to somebody in Rankin or Pecos.
Mm.
So we have technology in place that allows us to share imaging. Right, we have a tool called Pocket Health. It's an app. You can go log into your physician portal or to your hospital portal,
Hmm.
and all your records will be maintained there. So if you
Wow.
show up in an ER in Dallas, you're there for a Rangers game, your app is
That's
available. All your
amazing.
medical records are available to that physician. What should happen though is I would like to think that someday soon we'll all be connected, and you won't have to take out an app. Like if you're in Seattle, Washington for vacation and you're in a car wreck, when you walk into that hospital, they should be able to find you in our records, in
Wow.
Houston or Austin records, wherever you've lived,
Uh-huh.
by your social security number, your date of birth, all this key information, and go, hey, I can see that she has these
Mm.
complexities in her healthcare. I
Hmm.
need to take this into account before I treat her. Because if you're in a car wreck, you may not be able to give
Yes.
them a family history, or
100%.
here's the medication I'm on. So they're doing the
Hmm.
best they can with what they have. But why can't we do things so that that's readily available? And we've come a long way.
Truly,
Yeah,
even in
just to
the
have it on your phone now is a big step forward. We're getting there.
100%.
It's getting all the hospitals to agree to share that
So can
information.
I ask you a question?
Yeah.
Because like I have noticed that with my, okay, so I also have high blood pressure. Here's a HIPAA violation for you. I'm just telling you everything. I'm just kidding.
It's not a
Um,
HIPAA violation if
if
you
I
tell it.
if I
Yeah.
disclose it, that's
If I
right.
tell everybody,
I know
that
your
yeah.
attorneys are like, oh, I'm just kidding. But for me, I have to see a hematologist. And because I got so frustrated with my Texas oncology doctor, I went to Texas Tech here at the hospital.
Okay.
And I received so much better care here because they were able to say, okay, well, you're also with a cardiologist. And so you have to go over here. As somebody who's adopted and doesn't have a medical history, like myself,
Mhm.
it's so difficult to figure out what is an acute thing versus what is a genetic situation.
Sure.
And so it was very interesting to be able to have the different doctors that I have to go to and talk within my care plan. But recently, in the last 2 years, I've noticed the patient portal. So is that a thing that just all Midland doctors have said, this is what we're doing?
It's a
Or
government
I did
requirement
not
now.
know
Yeah,
that.
you're required to have a portal. You're required to have certain things available within a certain amount of time. And most of the electronic medical records that you certainly use in a hospital, and even those that are used in a physician's office, which are
Mhm.
different EMRs, the portal it's table stakes now. Nobody's going to buy your EMR if you don't have a portal that your employee could log into with a few key bits of information and then have access to all the medical records. So you can go see your lab results. You can
Right.
go see their schedule. And when am I scheduled to check up with him? I know I do every 6 months, but I didn't write it down that day. I could call the office or I can go in the portal and it'll say, you're scheduled for November 14th with this doctor.
I knew I could ask you as a former IT guy.
Yeah, but yeah, I'm certainly was not a very good IT guy. I got out there as quick as I could, but technology is in everything we do today. It
But
really
it's so
is.
helpful. I mean, I know I'm also an only child, so, like, at some point, I'm gonna have to care for my parents, and, I am the only, like, daughter-in-law, so I will probably have to take care of my in-laws.
Yeah.
So, with that being said, the portal can really help with that for caregiving. Talking about the last phase of life, what are some things that Midland Memorial does to support the elderly?
Yeah, it's a good question too. I can't remember the exact name of the certification. That wasn't on
That's
your
okay,
question
that's
list, but
okay, I know I'm
we have
throwing
a
you on.
silver certification for elderly treatment in our emergency room. So
What does that mean?
we have people that are specially trained how to deal with, how to spot issues with elderly patients that may struggle to communicate their
Mm,
issues, that may come in confused, that may be on a lot of medications but can't recall what it is, how often they take it, what
mm.
the dosage is. So we're certified. We have a designation. It's a silver designation. I can't remember who puts it out, but it acknowledges that we take
Wow.
steps with our staff and our physicians to treat elderly in our emergency room, and recognize that's a big part of our population. We also have a palliative care program, so
I
that's
didn't know that.
that's elderly, but it's also you can be young and have chronic conditions that you're not at the end of life, but you're on a path toward that. We all are, but you're going to have these chronic conditions that are going to make your path really difficult. It's
So
not
MS, ALS,
sure
like somebody
diabetes,
who has a trach
yeah,
maybe.
heart failure, all
Mhm.
these things that we live with, and we have a palliative care physician, Dr. Nur, who's been on staff for a couple of years now, specializes in that, trained at Tech, and so she works with these patients. Not it's a lot of people hear palliative care and they think hospice, and they
Different.
think we're not. It is very different, and this we're here. We know that day is going to come, but you're not there yet. So
Mhm.
what do we do between now and then to maximize your life? What do
Wow.
you want to get done? That's a different conversation than the last 3 months of life. What do you wanna do
Yes.
here? Do you just wanna be comfortable? And so we've started that program a couple of years ago. It's made great progress, and we have started it now with Kate Lagos, who is a advanced practice provider that does outpatient work with that. We partner
Wow.
with Hospice of Midland.
I love
They're a
them.
great partner of ours. Obviously, a lot of patients leave the hospital and go there, or they may even have their patients in the hospital and they treat them through end of life in our location. So there's a number of things we do for end of life. As you said, we're the only acute care provider in Midland, so we have to
Wow.
treat
Everything.
from womb all the
Mhm.
way to the end of life. And I think we have a lot of physicians and staff that take that very seriously. And so we have a lot of programs that are available to any walk of life to
Wow.
make their experience here as good as it can be. And I do want to say, we know we can't do everything. We're not a level 1 trauma, we're a level 3 trauma. I would say that
Still really great
it
though.
is, and we function as a level 2. I'm
Mhm.
bragging a little bit. We are licensed and designated as a level 3, but even when they come and do our analysis every 3 years, they come out and do an audit of our trauma. They say, "Why aren't you guys a level 2? You're doing level 2 work."
Yeah.
And the reason is it requires a lot of additional cost
So
and no
explain
additional reimbursement.
so explain that to me. So I used to when I was at SMU, we had a like kind of a volunteer program with Children's Hospital of Dallas, and I kind of understood a little bit at the different ERs, but I know
Sure.
Children's Hospital of Dallas and then also Cook Children's is a level 1 ER, right?
Right.
So for anybody who's not sure what that is, level 1 is like they can handle anybody, anything,
That's
any
right.
situation, and they have the highest level of care teams. It also has something to do with the level of physicians that they have and level of specialities that they have on hand at all times. And so my question is first off, what is the rubric if you can even speak to that? I'm sure it's very complicated, but then also, what at what point is what's the next step to move up to a level 2 because we have so many car accidents here
Yeah.
and I'm just thinking like even a burn unit,
Mhm.
all those things that happen in the ER.
No, great
What's the next
question.
step?
We get asked that a lot. Why aren't we a level 1? And it's a great question. So we are a level 3. The move to level 2, like I said, we function and we take care of level
Mhm.
2 things today. If a level 2 trauma showed up in our emergency room, we would
Mhm.
not send them to Lubbock. We would take care of them.
Mhm.
The difference in requirements to be designated as a level 2, it requires a certain amount of anesthesia in-house
Mhm.
24/7. It requires different level of pharmacy coverage 24/7 in-house. this is Midland. It's not Dallas. You can get to
Yeah.
the hospital in 15 minutes. I live all the way out in Green Tree, about as far from that. I can get to the hospital in 15 minutes. So it's like, do we really want to get that? Because there's no additional reimbursement that comes with being a level 2. It's just a new sign you get to hang that says we're
Wow.
not level 3, we're level 2. Our physicians would expect additional compensation if they had to stay in the hospital 24/7 overnight. So we've made the decision, there's the cost and there's no additional reimbursement, and we function as a level 2 today. So that maybe that's satisfactory for us. And that's where we've stayed. Now, level 1 is a big
That's
jump.
a whole other.
Yeah, that's multi-organ failure
Yeah.
management. It's a burn center. The
ECMO,
other
like
big
ton of
thing, oh
ECMOs.
yeah,
Yeah.
the other big thing that you have to be a level 1 is you have to have a certain level of pediatric
Yeah.
subspecialties that we don't have here, and we're not going to have here. We have 2 pediatric subspecialists. I hope that's all. That's all I could think of. Dr. Sinha, who's a pediatric neurologist, has been here for a year and a
I'm
half.
like his biggest fan.
Yeah, he's great.
He's
Yeah, he
fascinating.
came and knocked on our door, and his wife is in a residency program at Tech, and said, "Hey, I want to get a job here. My wife's we want to stay here." And so we got him set up, and he's been great for the community and really the whole region. His office filled up just
He's like the
overnight.
nicest person ever. He bet me at the Founders Blend coffee.
Okay.
And I'm a swim coach, obviously, and I need to get back with you. I'm so sorry I haven't had a chance to. But we're trying to figure out some ways to talk about some water safety and like how to create more accessible resources for families.
Yeah.
But he has such a passion for children and working
Yes.
with children. I mean,
It's a
it,
blessing that he's in Midland,
I
no
know
doubt.
all pediatricians are like that, but I was blown away that a pediatric neurologist was so gung ho on pro Midland. I just really
Yeah.
appreciated that.
Yeah,
So
and you have a guy like that comes in, and clearly his wife, and you're like, man, I hope he stays. I hope
I
he doesn't get
know.
here
I'm
and
like,
go,
don't leave.
we're leaving town as soon. I think they really like it here. I think they have every intention to stay. We're recruiting his wife and get her set
She's in
up here.
residency at
Yeah,
Tech.
she's about to finish. She'll finish next June, July, and so we're trying to get her to stay, and that'll keep him here. Yeah, we're really happy with their whole family. And then we have Dr. Nasahoglu, who's been here for 15 years. He was in Midland when I was still at
Wow.
ORMC, and he's a pediatric cardiologist.
Wow.
Very busy, does a lot of great work here, interacts with some of our NICU patients. So if
Mhm.
we have some basic heart needs, he's there and he can help.
Wow.
The other thing I want to say is we have a great relationship with Cook and Covenant Children's
Yes.
Hospitals.
So that was something that I've actually had like experience with as well. And I was so blown away about how easy it is for pediatricians to be able to get referrals, and then how easy it is for those doctors from Cooks to be able to come and help patients here at Midland. We had a pediatric cardiologist from Cooks look at my
Mhm.
son, and we were in within like 3 months, and I didn't have to leave Midland.
Yep.
Like, to me, again, challenging preconceived notions. I mean, I did not know that that was available.
It is, and it's expanding. Yeah, I'll talk a little bit about that. With our NICU opening, that has broadened our needs here. Because a lot of times, if you had a NICU or going to need a NICU, and you went to Cook or you went to Lubbock, you formulated physician relationships there, and that's where they were set up. And you just plan as a parent or as a patient to go back there going forward. Now that we have our NICU here and more people are staying here, we've had triplets that have been born in our
Wow.
NICU that have gone home and are healthy.
That's amazing.
They're fantastic. Their parents, we went every Monday and visited with them. We set up a lot of advertising, but we wanted to hear their story, and they were just so grateful. And I was so grateful that we could do it for them. Our whole staff was. We've had a bunch of twins that have come out. We've had 30 weekers that have been born in our
That's
facility that
wow.
have gone
At
home
30
healthy.
weeks.
Yes, that have gone home healthy. Yes. So what we're doing
That
there,
is so
so
complicated.
you don't have to go to Lubbock or so they're like, well, I do need a cardiologist though. My kid's doing great. Got to go home. It's fantastic, but I do need to follow up with the cardiologist. Should I go to Lubbock or Fort Worth for that? Well, as you, I'm sure know, they have an office at Midland Women's
Mhm.
Clinic, and they rotate these subspecialists through here every month.
Yep.
Some come every other week. Some come every other month. It just really depends on the need. And because they're such a great partner to ours, they come in once a quarter and meet with me. What are we doing? What are we not doing? How can we help you? What can we do to support you so that you can keep patients? They're like, we don't want to move all your patients to Fort Worth. That's what everybody thinks. They want to steal patients. No, we want you to be able to do what you can do here and know that we're there if you need us. And so we've talked about, hey, we need some more gastroenterology coverage for pediatrics coming through the Midland Women's Clinic office and they're very responsive to that. So we are growing their presence. and I think broadening the subspecialties that are floating through here, so people don't have to go to Fort Worth if they don't want to.
Or even Lubbock, because I know the developmental pediatrics is in Lubbock, and that's a whole subspecialty. We had the Ireton's that own We Rock the Spectrum here. We
Okay.
were talking about how the whole process of getting your child diagnosed with any developmental, I don't like to say disorder. I don't think that that's helpful,
Yeah.
but developmental ability.
Yeah.
And, that whole process is so difficult and straining. And a part of the conversations that we've been having is recognizing how difficult parenting is since 2020 for parents,
Oh,
like, working from home and then working for childcare, and then childcare is increased, and then like juggling your oil and gas job because the majority of people, work oil and gas, so they are affected by oil and gas here.
sure. Yeah.
So
We
what
tell everybody whenever they find out you're from Midland, they're like, "What do you do?" I'm like, "I work for a hospital." They're like, "Oh, we assume you're in the oil business." I'm like, "We're
no,
all in the oil business.
yes.
We're all dependent on this economy here, and whether you're a school teacher or a doctor
Mhm.
or you're an engineer that works in the oil field, like we all depend on it. So we're all in the oil
Truly.
business together."
So I'm so curious, what were some of the things that the hospital or even you personally learned? Like for me as a business owner, my business had to innovate because of what happened with the 2020. We have to be
Sure,
careful with
sure,
like
sure.
language. Otherwise we'll get flagged by YouTube. But um what did you have to do as a leader to evolve and change with the times of
Yeah.
caring for so many sick people?
Yeah, it was certainly I hope a once in a lifetime, once in a career event to have to go through something like that. But I've said this a couple of times. But the biggest thing I learned is when the chips are down, our people are A plus. Like I would put our nurses and our respiratory therapists and our physicians up against any big city hospital that's out there. Like chips were down, they stepped up, they worked extra shifts, they took care. They were in the most stressful environment they'd ever experienced. It's a stressful environment
Mm,
every day, and they were in an even more stressful environment. They're around this disease. They had to go home with their families to sleep, but what were they taking home? There were so
mm,
many unknowns, certainly early on. But Russell and Dr. Wilson, who was our chief medical officer at the time, and so many of our leadership team just kind of took the approach of, we need to be the voice of what's happening. We need to give people information. Whatever they choose to do with that information
mhm,
is up to them, but let's just be a voice of information. And so it was a challenging time. We had tough times that we went through, but we also, as you said, we learned to innovate. There were
mm.
things that we did with, telehealth is a good example. I talked a little bit about that earlier, but CMS wouldn't allow certain events of telehealth. Well, when this event happened in 2020, they opened up their regs and said you can do all these things
Does
that we've
CMS like
also
manage what
they're
hospitals
the
do?
Centers for Medicare and Medicaid. So
Okay,
and
that's your boss.
they're the biggest payer in the world.
Oh,
And so
wow.
if you want to get paid by them and take care of their patients, you have to meet certain regs that they issue.
Wow.
So yeah, they're the big behemoth regulatory bureaucratic
Okay.
process for healthcare systems. They do a lot of great things. Sometimes they do things that are we don't like or maybe or we're not well founded, but that we all deal with that. Oil business deals with regulatory changes too.
Bureaucracy
So
makes the world go around, I
that's I
guess.
guess it does. That's what they say. But we found ways to be innovative, and even today, we're way past that, and thank goodness we are. But there are things we learned during that we're still doing today because like this works. How quick can patients get out of the hospital with certain diseases? Well, because we were so stressed for beds, we were pushing the envelope on, hey, this person I would typically keep them another day or two, but I think they could go home today because we've got 15 people lined up in the ER that need a bed. And they were fine. We didn't see readmission rates go back up. We didn't see any kind of bad outcomes from letting people go. So we've been able to create capacity in the hospital a little bit by following some of those same things, doing telehealth. There's a number of things that we're doing, as you said, innovation, like things that we thought, man, we should try this, but we never really pushed ourselves, and we forced ourselves to do it during that time because we
Had
had to
to.
be innovative, and we're like, well, this we actually can do this, and it's not bad, it's
Six
great.
eight nurse is amazing.
Yeah, a
S
lot of people that's been around for 15 years, and people
I've
still don't know about it.
truly I have it's been helpful for me for any medical complex issues that I have, but also for my parents. Like my mom has high blood pressure.
Mhm.
And sometimes I'm like, "Mom, I don't like the reading that, you had," because she's like, "Hey, yeah, this is the reading I got." I'm like, "I'm not a nurse. I don't know anything. I'm an American Red Cross CPR, AED first aid course instructor."
Okay. So you're
Um,
not a nurse, but you did stay at a Holiday Inn
Yeah,
last night.
right? Exactly, exactly. And so for me, I'm just like, I don't know. So she would use 6-8 nurse and it has been fantastic. It's for people that don't know, it's
Yeah.
a service that the hospital offers,
Yeah,
right?
it's a what we call a telephone nurse triage system that we put in place about 15 years ago. There's no charge to use it. You call 6-8 nurse and tell them what's going on with you, and they'll tell you, "Hey, you're fine. If you maybe take some Benadryl or take this and follow up with
Mhm.
your doctor, or I need to get you into your doctor tomorrow. I don't like, or
Go
you need to
in.
come to the emergency room or sit down. We're sending an ambulance." So they
Well, I
evaluate
didn't
the
know they had that
Oh, yeah, they have we don't have an ambulance service, but we'll
right.
call 911 for you and say, "Hey, we've got a call on the 6-8 nurse line. This person's having a heart well, they need an ambulance now." So we'll make that
Wow.
call and manage that for them. No charge for
I
any
didn't
of
know
that.
that.
Yeah, there's no way to charge for it. But yeah, so we want to manage activity in the ER. We started out talking about the ER, and there's a lot of patients in there, and there's a lot of patients that don't need to be in the ER, but they don't have a doctor, they don't have insurance. There's we have to treat people in the ER. There's a law that's called the EMTALA is what it's referenced all the time. It's the Emergency Medical Treatment and Labor Act. But in that, it says basically the ERs have to treat patients regardless of ability to pay, regardless of status and nationality. Like they come in, they have a problem, we take notes and we treat them. And then once
Wow.
we determine whether they really need treatment or then we'll get financial information. But if you're in a car wreck, we don't ask for your right. We have to provide stabilizing treatment to
Yes.
anybody regardless, and then we'll deal with insurance or find out other things. So
And that's
people
not
know
like
that, and people go, "Well, I'll just go to the ER."
but that's not
Families come
every
in.
hospital though, because like it just not to badmouth another hospital, but I'll leave their name out. I've been to hospitals when I've had some issues with my blood clotting, disorder. The billing person literally comes in after the doctor. And that is so disheartening as somebody who's in the hospital to have a serious issue looked at. And the second person that they see is this like little person on their like rolling laptop and they're like, "Okay, well, where's your insurance?" When you're in having a medical emergency and you're not sure if you have to go get an MRI or a CAT scan or
Yeah,
whatever, and you're just like, why are we talking about finances right now? I mean, that matters in regards to patient care. And something I've really appreciated with, your hospital is that that doesn't seem to happen until the very, very end, if at all. I've noticed in the last couple of years that you guys have just done paperless or paper billing. And it takes that experience of like, if you've had something really scary happen to you or, there's just something really hard going on with you medically, it's not something that is gonna be thrown in your face, the logistics. Because honestly, like, that takes a lot of discernment to, like, read the room a little bit,
there's
and
a
I
lot going on. You
yes,
don't.
and I appreciate that from our hospital's perspective because not every hospital does that.
Yeah. Well, there would certainly be people that will tell you that's not been their experience at our hospital. If you're coming in for an elective procedure, an MRI, DIA, not in the ER, if you're coming in for an elective surgery, we do expect to collect payment.
Right, but I mean, like, in
Right,
the emergency
but in the
room
emergency room, we have
yeah,
a very different approach. We want to our physicians to be able to see the patient, assess where they are they okay? And then if they're okay, we'll come get if they're
right,
not, like,
right.
"Hey, I'm gonna do some other things," we'll come in and get insurance at the end. Like, we need to get paid. It's a very expensive to run our hospital in the full health system. We recruit physicians. So the cost that we bear to provide healthcare in the community, it's wide, and we have a lot of tax support here and that we're very beneficial because of what we very benefited much. We've benefited very much from having those tax dollars and what we've been able to do to provide additional services. But taxpayers don't want to pay for people in the ER that can't pay. That certainly people that have no means. I think our community, we've talked about how great they are. They want people to get care, but people that can pay, we need to get it. So
Yeah.
we have a process we follow. Some people still are not satisfied with it, but we have it. We follow it. I think it works. I
There's
think it's
only so
fair.
much that you can do. I
Yeah.
appreciate that even when you are following protocol and policy for the hospital in regards to billing, I do very much appreciate the attention to detail, especially in an emergency situation. Because sometimes hospitals can feel not to be crass heartless a little bit and
Yeah.
sterile,
Yeah.
and I can understand that emotional boundaries and everything, but, like, it's very kind, and I just really appreciated the last couple times that I've had to go in, have it, for random things, have it be with my family or, like, me or whatever in the last 9 years of living here. I've just really appreciated that because 'cause I've seen it go I haven't had the best experiences in other hospitals, so
Well, I'm glad to hear that. Certainly, you're going to get different, kind of interaction with a nurse versus maybe the registration person. But we encourage all of everybody in our organization has an impact on patient experience, right? Did they feel cared about?
mhm.
Did they feel like they were heard? People listen to them, and I don't care if you're a nurse or a EVS person cleaning up
Mhm.
the lobby or a food service. Like you could make a difference in somebody's experience at the
So,
hospital.
how are you guys I know that there's the Daisy Award,
Yes,
right? The
yeah.
Daisy Award is a award that is awarded to special nurses, right?
Yeah, you can be nominated by patients. There's a family. If Kit was here, he could tell you the full story. I go to a lot of the presentations. I was one at one just last week. But patients can nominate a nurse for extraordinary care that was given
Mhm.
to them or to a family member while they were in the hospital. And we get a lot of nominations every month, and then we have to make a selection. But we give them out every month, and then we give out a management one at the end of every year for a leader that kind of goes above and beyond for their staff. But yeah, I think we do a lot to try to recognize our team. Like I said, it's a stressful environment, and we all like positive feedback, and so we try to find ways to celebrate our clinicians and recognize them when they've gone above and beyond, or they've been recognized by a family member or a patient or whatever it may be. We do a lot of recognition things in our organization. I think it goes a long way. It really does. I think that's why people get into healthcare is they want to help people, and I think for somebody to be able to say back like you helped me, that's really what people are looking for. So we try to take advantage of those things and recognize our staff every chance we get.
What has been one of the best things that you have seen over the course of your career
Wow.
that has, given you hope for the future of healthcare, but also the future of Midland?
Yeah, I've given these examples a few times. So if you've seen me on something else or heard me, forgive me. But they're still the ones. The 2020 event gives you hope, right? Because you see how your people step up. I don't know when you moved to Midland, but very early on in my tenure here, we had a parade going on, and it got stuck on the train tracks, and
Yes.
it was awful.
It was a
And
Veterans
yeah,
Day for people that
it
don't know. It was a Veterans Day,
was a hunt
parade
for heroes. I think
for
they were.
heroes.
Yeah, great event.
Mhm.
But, one of the parade
Trailer
truck
kinda
trailers got stuck on the train tracks, and a train came and hit it. Several people were injured, beyond injured, and they came to our facility. It happened just up here on Florida, I think, and, up here on one of the train tracks. I can't remember the intersection, but
it's about
they
5 blocks
they
away
came
from
to our
here.
facility, and, same thing. You see people respond to those kind of environments, and you're like, we're gonna be okay. Our people are first class. I'll put them up against anybody. I've had several events like that, personal events. I had my tonsils taken out whenever I was 32 years old. I was old and I was about 80 pounds heavier back then. And Dr. Vic Patel, who's an ENT in town,
Dr. Patel.
everybody knows him. Yeah, he's been here forever. Dr. Colson's an ENT, but Dr.
Mhm.
Vic Patel took out my tonsils. But he said, "Oh, you can't take your tonsils out. You're too old and you're overweight." And I was like, "Well,
I could see him saying
I'd
that.
really like to get them out because I'm sick all the time." And he goes, "Well, let me look at them." And he looks and he goes, "Oh, wow, those got to come out. Yeah, they're
When
bad."
a surgeon who
Yeah.
only does that tells you
Yes.
that and is shocked, then you
Yes.
should
He's
probably
like,
have the
"They got to come
surgery.
out. We'll do it next Friday." So I got it taken out. I followed the rules, but a week out, he said you need to be good for a week. A week out, I got cleaning up. It was a Friday. I had my surgery on a Friday. It was the next Friday. I was going back to work Monday, and I got a little active and I
Oh,
shouldn't have.
no.
And that night I bled and I had to go to the emergency room, and Dr. Patel wasn't in
Cauterize
town.
you.
Yeah, and they couldn't get me cauterized in the
Oh,
ER,
no.
so they had to take me back to the OR. Um,
That's fun.
yeah, and it was intense in the moment. So you're kind of living in the moment. I was intense. My wife was. There was blood all over our house, and I'd
That's
like
fun.
my kids had friends spending the night,
Oh my
and yeah.
gosh.
So my mother-in-law comes over, and she takes me to the hospital, and we finally get home that afternoon. But I got emotional on the way back. I was like, this is why he said you don't take out tonsils for old guys overweight. Like you should have done this when you were 10 years old.
Yeah.
And he knew they had to come out, but it was like
I've heard that
this could have been
surgery's
bad.
rough.
The whole recovery was a piece of cake. It was about 10 years ago or 12 years ago. It was baseball season because I sat in my chair, I watched the baseball playoffs, I ate pudding. It was a great week.
Nice.
And I was like, I made it a week. I can do some stuff now. And I should have just waited till Monday. But yeah, he was out of town. But I mean, I saw people come into the ER and you got to know, I hadn't been at the hospital very long there. I don't think anybody had a clue who I was. Like, oh, this is the CFO. We need to come in. I don't think they had a clue who I was. And I got fantastic care. So yeah, the people that work at our organization are what give me hope.
Also,
They're first
to
class.
shout out firefighters and EMS, and police officers as well. First responders, they're a lot like any mom listening can also appreciate this. Delivery room nurses are like just a certain brand of people, I think, from heaven. Truly. Delivery room nurses and
You can't shake
OBGYNs,
them.
truly, but they're also just like the most kindest, like sensitive, empathetic people. I think first responders are very much like that as well. I'm a big advocate for firefighters in particular. And I think it's really important that the city of Midland's first responders and the hospital work really well together. And I think they really do. This last time I was hospitalized because I had the stomach flu, I was so dehydrated. I had to have EMS take me. And that was first time I've ever had to ride an ambulance. It was so embarrassing because I'm like, oh my gosh, I feel like I'm gonna be sick. And like, it's not fun when you're in your 30s and like it feels very dramatic, and
Not to them.
not to them. They're like, yes, this
This
is
is
like
our
happened to
job.
us.
This is what we do.
Yeah.
Yeah.
And, it's can be very embarrassing because like, when you have to go to the hospital, they're like, you don't want to overreact, right? And I feel like it's very prudent to recognize that I feel like oftentimes adults, especially in West Texas, we're like, put some salt on it, you'll be
Yeah.
fine.
Yeah.
But for people to take you seriously, I think that's a big thing that should be, noted and complimented, that first responders in Midland do take you seriously, and so does the hospital staff.
Yeah,
At
they
least
do.
from my experience,
You
my
don't need to
family's.
be ashamed to call 911 if you're not sure.
Yeah.
Like, they're not going to make you feel bad about calling and bothering them. Like, they live for that phone call. They're not sitting in their offices hoping nobody dials 911 today. Like, they want to go to work.
Yeah.
So if you ever have any doubt, call 911. The ambulance will come pick you up. They'll bring you to us. And those people will not make you feel ashamed about doing that.
Mhm.
Even if as you turn out, you didn't need to do that.
Yeah.
Like, they live for that stuff.
Yeah.
That you're making their day.
They're
but
like
they
they're
want to help people.
just like delivery room nurses, they're just born to do that.
Yeah, yeah. They don't want to see no babies born every day. Like, you'd think, like, I bet a nice easy day. No, we want somebody. This is
They
what we
want
come to do. Yeah,
They want to do what they were born to do.
that's right. It's happy
That's really
time. It's
cool.
the happiest unit on the floor most of the time.
Truly.
People
So
that want to be there.
yes, they're
They're
so
planning to be
nice.
there.
And they're so like, I don't know, just all the nurses in Midland Memorial, and then all the different campuses too. For people that are not familiar, how many campuses do
Oh.
you have?
Well, we have two campuses that we own. We have the main campus, which is where all the inpatient care is. That's the main hospital at Illinois Andrews Highway, Roslyn Redfern Grover
Mm.
Parkway, there where the parking garage is. That's where all the inpatients are, and a lot of outpatient services. That's where my office is. We also have the F. Marie Hall Outpatient Center, which is just up the road on Andrews Highway. That used to be a hospital,
Uh-huh.
and it was focused on women's and children's services.
Mhm.
It was owned by another company, and in like 2000, the hospital bought that. And so when I got here in 09, all the deliveries still happened at F. Marie Hall Outpatient Center. That was a hospital too.
Wow.
You stayed overnight, but that was pretty much what they focused on there was women's and children's services. But you had to duplicate pharmacies. You had to have an ER at both campuses. It was expensive to run two facilities. So when we built the new tower, we moved L&D.
Consolidated.
Yeah, all the inpatients there are there now. But at FMH, we have a lot of physician offices. Dr. Vic Patel's over there. Dr. Colson's there. We have dermatology, MCHS. Their pediatric clinic is upstairs. We have imaging there. We have our lifestyle medicine center there. So a lot of outpatient ambulatory services.
We didn't even touch on lifestyle medicine.
Oh,
I'm sorry. There's just so
No,
much.
it
There's
is.
so much involved with the hospital that it's so interesting. I'm trying to make sure I'm going through my checklist. So the lifestyle medicine, tell us about it, because I feel like truly that's what keeps you out of the hospital.
well, it is. And a lot of people are always surprised when we talk about, lifestyle medicine and take care of yourself. Like, I'm
What does
not
that
I'm not
mean?
quite there yet, but there are
Yeah.
people that say if you have to go to the hospital, that's a failure in your healthcare system. You
Yes.
shouldn't have to go to the hospital.
No.
Obviously, if you're in a car wreck,
Yeah.
if you're having a baby, there are certain instances where you plan to go, but if you have something happen that's unplanned and you go to the like somewhere along the way there was a failure in the system because you should be taking care of yourself to where you don't have to go to the hospital hopefully. But our lifestyle medicine is really built around our food as medicine deal, right? Marcy Madrid, who's our VP of community health, and she's been in the organization a little longer than I have. She was in marketing originally, and now
Wow.
she's really passionate about her healthcare. And I cannot do her story service. You need to go watch her story or have her on because she's very inspiring. But she was diagnosed with MS,
Wow.
and as a very young woman who had children, and did the traditional thing, went to Dallas, got a doctor, got on medication, was dissatisfied with it, didn't feel good, was lethargic, and started doing her own studying, right? Just like these powerful women can do, just like you were talking about, just like my wife would do.
Mhm.
Started reading online, studying, trying to find a way. And she went to her doctor and said, I'm not taking the medicine anymore. I'm going to try this. I'm going to try to change my diet to feel better. And I think he told her, well, that probably isn't going to work, but
Mhm.
good luck. I wish you wouldn't do that. And she went off and did it, and changed her life. And she went back to her doctor a year and a half later, and they did another MRI, and her lesions were gone. Just
That's
yeah,
insane.
you need to have her on to tell that story because it's an amazing story. I've seen the MRIs. Here
Because
was my MRI.
MS in particular, also like just other degenerative disorders like ALS, even, um, that is just so complicated. And to be able to at least have
Yeah,
someone who can speak to the power of taking care of yourself. And I feel like that's so ambiguous. I'm sorry. It's pretty privileged to say, like, you gotta take care of yourself when the majority of Americans right now are like holding on for dear life just to get by.
sure,
Price groceries, stress,
sure.
childcare, all the things. So
Yeah, you gotta have Marcy on to tell her
it's
story, and she can carry
fascinating.
that lifestyle medicine
But
and taking care of yourself.
well, what I'm saying is like in regards to learning about how to take care of yourself, I mean, for people who are stressed, it is so nice to be able to have somebody break it down because not everybody knows what that is because they haven't been given the chance to take care of themselves.
Sure.
So it's really nice. I know I have been taken part of the lifestyle medicine's week of health, like
Okay.
healthy week, where they
Yeah.
teach you, they have
Yeah.
food classes and they have like mental wellness classes that you can take. There's yoga and like I just really appreciate that because I've had friends that have not did not grow up with somebody in their life saying, "Hey, this is actually how you take care of yourself." And I think that the way that the hospital goes about doing it is it creates an accessible way to receive helpful information that could change the trajectory of people's lives, you know? Not
Yep.
everyone is born into a family that can say, "Well, this is how you do it."
Yeah.
This
We're a
is
product of our environment. We
yes.
definitely are. So yeah, having that available, it's great. We want to reach as many people as we can. We're not reaching as many people as we'd like, but it's one of those things you really can't force on people.
Mm-mm.
People are resistant to it if it's forced, but there are people that are looking for it, and we find that more and more people are finding it. A lot of them are our employees, which has a great benefit. When you think of the patients that we're really at risk for, we're a self-funded insurance. We have insurance on all of our employees. If they get sick, we have to pay for their health care.
Mhm.
We have to replace them in the nursing floor if to
Mhm.
have another employee there. So we're vested in making sure our employees are healthy. And we've been able to prove some things out. Like we've done this for a population, and if you do these things, it will make a difference. And so, how do you take that to the school district? How do you take that to the city employees? When you think
Yeah.
about other large
Public health.
employers, yeah, how do we extend what we've learned with our employees and offer that up to others? You can't make people do it, but is this something that would be of interest of you? Here's what we saw: a reduction in cost. We saw more days
Really?
at work. We saw healthy days at work. We saw less time on sick time. All these things added up, and we're like, this really makes a difference. And what else? What other buttons could we push? So our employees have
Wow.
been a great. We have 2,500 employees within Midland Health across all of the entities that we have. So it's a great population to try, and
Yeah.
they're interested. They have some knowledge about healthcare, and I think even that they may have grown up in an environment where they don't know how to do it, but they know they should
Yeah.
because of the world they work in. So having that available, they're the biggest takers on the lifestyle
That's
medicine. We
so
have people
neat.
in the community that do it too, but it's been great to see our employees take advantage of it and to benefit from it.
They can speak to it for
Yeah.
sure.
Yeah.
What other projects do you have coming up that you want to highlight?
The one, but I'll let Russell carry it in his deal, is
Oh,
our behavioral
yeah.
health center. That's really exciting for us to do. That was Russell's really his last pride project, and I think he wanted to step away from the CEO role to really focus on getting that done. But that'll open in April of 26. Is planning to. It's a 200 bed behavioral health hospital. There's nothing like this west of I-35 in the state of
I was
Texas,
blown
and so
away.
yeah, the work that he's done on that, and Speaker Craddock and Brooks Landgraf and
Mhm.
Odessa and all the donors, the population that we have here, all the foundations, the Scarborough Foundation, the Abel-Hangar Foundation, I mean, FMH Foundation, all these guys
Feel
just they love
mhm.
this project, and they're like, "What do we do to help this happen?" And so, they broke ground. They're building over there, but that is going to be a real game changer for our community. It's going to be a game changer for our hospital. A lot of those ER patients we talked about them. Some of them they're not acute, they're not sick, but they have something going on, and there's nowhere else for them to go. So we have
Mhm.
psych patients that back up our ER that need our help, but we're not the best person to deliver that
Yeah.
care. So you're just trying to temper it a little bit. Now to have this behavioral health center, it's going to benefit the community and the full region. It's the Permian Basin Behavioral
Yeah,
Health
because
Center.
Ector County is also
Yeah, it's a
investing in.
partnership with us and Ector County doing it together. So this is the first thing that I've ever been a part of its kind,
It's
and
amazing.
having Russell really kind of lead it up to that finish line. He's the right person to do it. It's been a passion of his for a long time, and so I'm really excited to see where we go with that
That's
in the next
awesome.
couple of years.
The last question I have for you is just because I'm curious. There was a building that y'all tore down that was right across the street from Chick-fil-A. What
Mhm.
was that?
So that was an old Chase Bank building,
Uh-huh.
and it was owned by a gentleman in town that was a commercial property investor,
Uh-huh.
and he had started a little work there. And I think during that 2020 event, there were a lot of things that happened. And he's a guy that's very engaged with the hospital, and he had heard Russell speak somewhere about need for additional space. We had looked maybe for an expansion for Tech's residency
Mhm.
program, and he called Russell and he said, "Hey, do you want this building? I'll sell it to you for next to nothing. I want to get rid of it. I'm focusing
Yeah.
my investments elsewhere." And so we talked to our board about it, and we ended up buying the building.
Mhm.
And we went down several paths for about a year trying to make that work, and we couldn't make it work for Tech. They didn't need the whole building.
Mm.
The economics didn't work unless the whole building could work. We looked at a couple of other potential tenants, and they didn't work out. So we ended up selling the building. We didn't tear it down. We sold it to a commercial investor out of Lubbock,
Oh, cool.
and they bought it. And they told us when they bought it, we're going to tear it down. And they've got big plans there. I can't talk
Yeah,
about
yeah,
what
yeah.
those are.
I
I
was just
can't say I
curious.
know what they are, but
Yeah.
they bought it from us and immediately did the tear down. But there will be a commercial property development
Wow.
there soon, maybe some restaurants or
Oh, neat.
uh, 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 some
Cool.
other things. So that's coming. But that wasn't us. We did own it for a while, but we really didn't do anything to it. We sold it to a company, and they tore it down
I just
immediately.
like to look on Nextdoor and like see what people are talking about. They're like, I wonder what's going to be there. Like,
Oh,
because they, once
yeah.
a couple years ago, it had like a Midland Memorial sign and like future Midland Memorial something. And so I just wanted to give you the opportunity to speak on that
Yeah, we
because,
had great plans. It just didn't work out. But that led us to the last thing I'll talk about,
yeah.
if you'll let me, is our current project now. If you've driven by the hospital, there's a lot going on there.
Yeah.
There's
What's
a
all the
crane out front.
constructions?
Yeah. So our board, about a year ago, it was November of 23, they approved a project, about $157 million project. That includes a couple of key things: is a new office building, 100,000 square foot office building, 4 stories, that'll have some hospital services in it, but it'll also give additional physician office space, which we
Mhm.
need as we continue to grow. We have some patio areas that were built when the hospital was originally built. They're just empty areas in the middle of the hospital. They're like garden areas.
Mhm.
We're building those out to take advantage of that space. We're building out 2 ORs. We talked about the NICU and the shelled space. We shelled 2 operating rooms when we built the tower,
Wow.
and we need those now. So we're building out 2 operating rooms. We're redoing our endoscopy center where we do GI procedures. We're building out the Abel-Hangar Pavilion, which is right across the
Hmm.
street from the hospital. Our pharmacy's over there today. We're moving our pharmacy over to the main campus. That our main pharmacy, who serves inpatients and does most of the medication work, is in the main hospital. But we also have an outpatient pharmacy that serves our employees that are on our health
Oh,
plan
I didn't know
and
that.
indigent patients. So
Wow.
we'll fill a script for an indigent patient for $5 a month. Just the best way to keep people out of the hospital is to get them their medication and make sure they take it. So
Wow.
that's what tax dollars go to, is to fund those kind of things to keep people.
I didn't know
It's a
that.
lot cheaper to give somebody their prescription every
Right.
month than to have them show up in the ER and they haven't been taking their diabetes medication. They may need an amputation of their foot because
Yeah.
it can get out of hand. So, but we're moving that over to the main campus because we're going to expand on what we do as an outpatient. As you may know, there's not a 24-hour pharmacy in Midland anymore.
That's right.
Walgreens used to be 24 hours. During that same 2020 event, they
That's
stopped
right. They
being
did
24
stop.
hours. There is one in Odessa, but there's not one in Midland. So if you get discharged from the hospital
I
at 5 or
know.
6
You have to
o'clock,
wait.
or the emergency room, and you need a
Mhm.
prescription, if it's a Friday, it might be Monday. It may be 2 o'clock tomorrow afternoon. So we're moving our pharmacy over to the main campus, and we're going to start a meds to beds program. So when people
Wow.
get discharged from the hospital, we're going to make sure they leave with their medications, whether it's an inpatient discharge or somebody getting
I'm just
discharged from
thinking
the emergency room.
I'm just thinking as a parent, so if your kid comes in and like, let's God forbid, has an appendectomy,
Yeah.
their appendix gets taken out and they need to take something. I've never had it happen, so I don't know what medication that is. But let's just say they just need a higher dose of Tylenol, instead of that parent, like if they get discharged at like, I don't know, 6 a.m. in the morning, they're going to be exhausted because they
Yeah.
were caring for their child the whole time. And the last thing they want to think about is trying to coordinate with Walgreens to get their
Yeah.
medication. So that will be so
Or you
helpful.
have another child and maybe your spouse is working, so
Yes.
that you have insurance and you got to carry your kid to Walmart or Walgreens and it takes them hours to get the script filled, but you can't go drop them off at home and tuck them
No.
in and then go back and wait because they're kids. And so we're going to make sure people leave the hospital, inpatient discharges, and people that leave our ER with the script
Wow.
they need. And then if they want to get their refill, they can plan for that a little
Yeah.
bit better. But when they're leaving and they're sick, and we don't want people in the hospital any longer than they have to be there. Go home. Here's your medication. Go take it. So that will open up and be a game changer. So that'll move out of our Abel-Hangar Pavilion. The first floor, we're going to relocate our infusion services department. I don't know if you've had to use that. You said you got shots, but we do infusion. Some are 30
Wow.
minutes
So
for
like
patients. Some are
iron
6 hours.
infusions. I know
Yes.
people who have Crohn's disease have to do iron
Everything except
infusions.
chemo, right? Anything cancer related,
Wow.
we won't do. But again, patients sometimes are ready to go home from the hospital, but they need 6 more weeks of an antibiotic and they can't take it by mouth. They have to have an intravenous. So in the old days, you just kept people in the hospital for 6 weeks. Now we'll discharge you and say, come back every Tuesday and Thursday to our infusion
Well,
center and we'll give you an infusion. Right now, that's on the 6th floor of the hospital.
wow.
So you have to park, you have to go into the main campus. This will be on the first floor. Abel-Hangar have its own parking, state of the art, have private rooms with beds for people that have 6 or 7 hour infusions.
Infusions,
We'll
yeah.
also have a community area like a bullpen with TVs for people that come in and get 30, 45-minute infusions. They come in, they can chat with other people. It's an open
Wow.
environment, and then they leave and they go right to their car and they exit. The second floor, really exciting, is a new simulation center that we're going to open up.
Oh, so are you talking about like robotic surgery?
Well, we have a lot of robotic surgery, but the simulation center that we'll have will be for training our new clinicians. It'll
Wow.
have an OR, it'll have L&D suites, it'll have ER rooms, it'll have critical care rooms, it'll have med surge rooms,
Okay, pump the
like
brakes for a second.
19 different rooms that mirror the rooms in the hospital.
So
Equipment,
that happens in medical school. And
that's
I
right.
know that the new PA program just opened up.
Yes.
So Texas Tech, if you're not familiar, and please correct me if I'm wrong. I'm trying to recall my research. Texas Tech recently partnered with Midland Memorial in order to bring in a physician's assistant
It's on the
program.
Midland College campus.
Midland College campus. Okay,
Yes,
cool.
yes.
But I know that
We
some of
partner
them.
very closely with Tech.
Okay,
Yes.
great. So, how are you guys integrating education? So it sounds like you're doing this whole other floor. How, who is helping staff that? Who is helping
Yeah.
teach the simulations?
We have 3 certified simulation coordinators. There's a simulation center, a great one at Midland College. There's a fantastic one at
Wow.
UTBB that we sponsor. Actually, our name is outside of it, and we gave money to that. And that's great for new students. And our staff can go over there sometimes. But what we found with, again, technology changing, it's once they're out of Midland College and they're in our hospital, technology is still, where do we teach people about new equipment, new devices, new care provide that we may be providing to patients? So this simulation center, as I said, it'll be set up with all these rooms that mirror rooms in the hospital. So when staff go in and train there, and then they go to the real world, it's all set up new, same equipment. Look, the room looks the same. It's laid out the same. All that very important. Well, we also have a general surgery residency program. So
I
the
didn't know
OR,
that.
yeah, with Texas Tech, we
That's
have
amazing.
a pediatric residency. We have a psychology residency. We have internal medicine, family medicine, surgery. I know I'm forgetting some. OBGYN, we have a residency. Yeah. So they will be able to train up there as well, not just our staff, but
Wow.
physicians. It was really important. Dr. Viney, who's a longtime Midlander,
Love Dr.
and
Viney.
yeah, he's still doing surgery. He left his group, but he leads the surgery residency for tech. He said, "You got to build me an OR in that simulation center. I want to be able to train these future surgeons in a state of the art environment." And so we put an OR in there.
Did you know that this is, I hope my friends who are OBs don't get mad at me for misquoting this, but because I was told this when I was having my son, that most OBGYNs can get an emergency patient in and like ready to go for an emergency C-section in under 5 minutes.
That's 5 minutes sounds pretty amazing to me, but they are fast. There,
Like,
we have two OR suites that are used just in L and
I
D,
mean,
just
like
for
if they're
C
already in the
sections.
hospital, like
Yeah,
swabbed up, ready to go,
yep.
like it just,
We have anesthesia
it's so
providers there
quick.
24/7. So if you're going in, you need anesthesia, they're there. They
Isn't that
sleep
amazing?
there.
But that I can understand Dr. Viney's perspective
Yeah,
of like this. I mean, if that's true, what I just said, um, they have to really understand how quickly that works before it happens so that, you're not the resident who's like shocked how quickly everything's moving,
yeah,
you know?
it can happen fast. Your OB friends know well, and so so yeah, the project's coming along. It's really exciting. The last thing we'll do as a part of that is we're going to tear down the old part of the hospital,
Wow.
the original 1950s
Yeah.
version, which is it's just a money pit. Deferred
Yeah.
maintenance, elevators don't work, plumbing. We in our boardroom, we had a board meeting today at lunch. We had to move it last minute because I came in this morning flooded
Oh no.
because the pipes are just shot. So that's not the tear down. People are kind of like, oh, that's not really exciting, but it really prepares us for the future. It'll be a parking lot for a while, but we've got future plans that as we continue to grow, we can come back with another tower that could connect to the Scarborough Tower so that we could expand beds. We could expand L&D. We are doing some expansion in L&D now. That's our fastest growing service line. We did 2,595 deliveries. I think in fiscal 23, we did
Wait,
2,800.
20, like
Yeah.
2,500 babies.
Yeah.
That's so
2,500
many
babies, almost
kids.
2,600 in fiscal 23. That's the 12 months ending September 30th of 23. And this year we did 2,800.
Okay, hold on. Now I have
So
another question, follow-up question. How are we preparing our hospital system to take that's a lot of people.
it is. It is. If you're paying attention, they've been talking about this a lot. The city talks about the average age gone down. The school
I know.
district
Well,
talks about it a lot
the
during their
Midland
bond is there's going to be bigger need for these buildings as we go. We have to do something now. I think the largest age group in Midland is 0 to 4 years old. It's the largest population of the age
that sounds
bands that
like
they
anarchy
track.
ready to
It
happen.
is
All these
right.
toddlers
They're
being
coming for
like,
us. They're coming for us. But we've got to be able to expand that L&D service without a new tower. That certainly long term we may need that. But we had an area called antepartum where it was meant for long term stays, not women in
mm,
labor. But we're building that space out to provide additional L&D space where we can do deliveries over there. That's going to open by the end of the year.
oh
That'll
wow.
give some more beds and capabilities to the floor. We want to minimize any induction delays that we can. That's probably a complaint that you've heard from friends, and certainly that I hear.
I
It
was able to get mine, but I think I'm a
it
little
doesn't
different
happen all the
situation.
time, but
Yeah.
and I can give you a basic outline. We have 10 L&D rooms, and so if you did 10 deliveries every day, that's 300. We've never done 300 deliveries in a month. The most we ever did was August. We did 255.
That's so
In
many
September,
kids.
we
Oh my
did
gosh.
254. So if you did one in every room every day, there's still capacity there. But the key is, these OBs they got an office full of patients and they're trying to deliver babies. So they all schedule their inductions for 7 a.m. and they want to come in and do them. And that's great. And everybody plans. You take off, your husband takes
Mhm.
off, your in-laws fly in for the
Mhm.
event, right? You take your kid out of school, you plan everything. And it's, as I said, it's the happiest place in the hospital. Usually
Mhm.
it's exciting time. But then two people come in overnight they were not scheduled. And now
Knocks it out.
there's two rooms that, the OR does this very well all the time. We have all those rooms are scheduled every day and the team works really well. And I don't think we've done a great job of working with the physicians and anesthesia and our nursing staff on how do we manage these delays? Who do we delay? Who's better to
Mm.
delay than others?
That's
And
like
so,
playing God though.
yeah, well, it's a
That's so
tricky, yeah.
hard. That's such a hard I can have empathy for your staff because it's difficult because you have to like coordinate, okay, well, who who's urgent, who's like secondary urgent, who can wait. Like that's got to be so difficult.
It is, and I think they do the best they can. But I just met with our OB group just a week ago, and they're great. They're very collaborative. They don't come in and yell and complain. They're like, hey, we're seeing more. What can we do?
Mhm.
Here's what we think the hospital could do to help. So it's very collaborative, and they brought in a couple of really good ideas that we hadn't considered. So we're evaluating those things and making sure they're a part of those delays, right? They know their patients better than we do. Hey, this person can be delayed. I know they can.
Yeah.
Let's get this person in. And so let's make sure it's a more collaborative approach. We have a history of recovering people that have after they have their baby in the L&D suite
Mhm.
for so long before they move to the women's and children's floor, where
Mhm.
we do couplet care. The baby goes into the room with mom.
Mhm.
We don't have a nursery anymore. We have a
Mhm.
NICU, but the baby is in with the room with the mom. How soon should that happen? And maybe we could open up beds faster. We don't want to go too soon.
Yeah.
But we don't need to linger in the L&D suite for a long time
Yes.
if there are other people waiting. So, again, the physicians can know, like, hey, we need this. That was a tough delivery. We may want to recover in here for a couple of hours versus, hey, that went really smooth. That was her
Let's
third
go.
kid. Like, she's great. Like,
Oh yeah.
we can go across the hall in 30 minutes. And so make sure that everybody that's a part of the care team is involved in those kind of decisions. And
Wow.
our nursing staff drive a lot of those things, and it's because the docs are busy, right? They want the nursing staff to do this, but I think they want to be a part of it. When you're really tight like we are now,
Mhm.
it impacts their life. It impacts their patients' lives whenever these things happen. So that's what they've asked is, can we be a part of this? I'm like, I want you to be a part of this. I think our nursing staff want you to be a part of this. We want to make, you know, multidisciplinary approaches to how we take care of this really busy service line. There's plenty of room to do the work that we need to do in our
Mhm.
community right now. I know there's comments around, we don't have enough staff, we don't have enough room. Yes, we do. We've got to get a little more efficient, I think, and it's going to take all of us to get that done. But I think all the players are engaged
Yeah.
and they want to be a part of a solution. They're not saying, "Hey, you fix it, and I'll tell you if it doesn't." We don't have that. Everybody's engaged and wants to make it better, and so I know that we can making this antepartum space into a working area where we can do deliveries as well. It's going to open up some room for additional staff as well. So
Also,
we're excited
I
about it.
think it's helpful too that we're getting support from Midland College too for staffing. You're getting support from TPB,
Yeah,
Texas Tech. I mean, Russell was talking about how the new behavioral health center is being fully supported through different avenues for
yeah,
staffing. And, we were talking to Andrew Lancaster Jones, who's the executive director at the Boys and Girls Club. She's saying that, the new trade schools, like we're raising our next generation to work within Midland, have it be from, an electrician and a mechanic all the
yeah.
way to a doctor.
Yeah, same thing for healthcare. I mean, you've talked a little bit about it. Your husband's from here. You came
Mhm.
here, but it's hard to recruit 20 nurses from Austin to move here.
Mhm.
So we have to invest. We've gone beyond Midland College and UTPB now. We're getting involved at Legacy and Midland High and Midland
Oh,
Career. What can we
wow.
do to who has an interest in a healthcare field, and what can we do to prepare them sooner? And tell them what the path is. Just like engaging with a mom who's about to have a baby and has a million questions, somebody might go, I want to be a nurse, but I really have no idea how to do it. I don't have anybody in my family. Well, we have teams that will reach out to you and say, here's the path. Here's what you can do. You can work at the hospital while you're doing this. We'll pay for your education. We have a great Midland Memorial Foundation that it was the original builder of the hospital that has tons of money available for nurse education. And if we have somebody that wants to go to nursing school and they can't afford it, our foundation will make sure that it's covered. If you're
That's
an
amazing.
LVN and you go, I really want to move to an RN or I want to go get my Bachelor of Science in Nursing, our foundation will take care of it.
That's
It is
amazing.
first class. It's so unique. And our people that know it are always shocked. They're like, when they find out about it, I had no idea. But our staff will tell you, like, yeah, it's not a high hurdle to clear either. If you're an employee, we know who you are. We've always taken care of it. But what we're extending now is we're going out to high school and we're finding high performing students that may not have funds to go to college. Of course, we have Falcon Free at UTBB. Midland College has their program that, if you're underfunded, you can still get a free education. But once you're past that point, if you want to go and extend your education, we have a foundation that has funds that'll pay for those kind of things. We've
Wow.
sent pharmacy techs to school to be pharmacists. We've sent LVNs to school to be RNs. Like, it's
I didn't know
unlimited what
that
they'll
because
do.
when you think nonprofit work, you think, oh, they're just building new buildings or like they're, building things that are.
Yeah.
I mean that while that's
We can't
important,
build buildings without more people.
exactly. And
We need people to staff it.
I think, another thing that we've been learning, I know Ryan and I have talked about this too, like one of the things that we're learning that we didn't really intend to learn, but it's just something that we're learning, is that there's so much investment going back into the community that's starting at the high school level.
Mm.
I mean,
$1.4 billion bond, I think it was.
yes, but more
Yeah.
so like it's not just the schools being renovated. It's not just, safety programs being integrated into schools. It's also other outside community members that are saying, this is what, no, we're going to put our money where our
Yes,
mouth is because we need a workforce.
they do.
And I think I've just been really encouraged because it's so easy for us, again, to go back on our preconceived notions of like, man, there's nothing happening, or like, what are we going to do? And yada, yada, yada. Any day on the internet, you can see people talking about that. But truly, it's because there's not an environment, and that's what I'm hoping we get out of this podcast, is where we're talking about how these collaborations are happening. And if you're not in the room talking about them with you, or Midland College or whatever, you may not have known them. So on that note, there's so much more information that the hospital has about the services y'all provide. Where can people find all that
Yeah,
information?
most of it you're going to find at midlandhealth.org.
Okay.
We have a communication page on there that lists all of our services and how to get access. The childbirth classes, all that stuff is available, but there's also a main phone number. If you can't find what you're looking for, call 221-1111. It's the main hospital number. Operator will pick up the phone, say, I'm looking for help on childbirth classes. They'll connect you with the right person.
Great.
So we have a lot of services. We have a lot of capabilities. Also, I'd encourage you all to visit the Midland Memorial Foundation's webpage, Midland Memorial Foundation. I don't know if it's .org.
I'm pretty sure.
And there's a donation link there. Our project that I talked about, it's a $157 million project. We did $89 million, or about $111 million in hospital funds went in. We're raising $45 million locally. We didn't do any tax increases for this. We've raised about half of that $45 million. And so we're
Wow.
looking for people that'll participate in that. If you're interested in coming on a tour, call the foundation. We're doing tours. We're doing coffee tours in the morning. We're doing lunch tours during the lunch hour. We'll feed you lunch, but
Cool.
we'll give you a quick tour and show you what we're doing, take you back, feed you lunch, and I'll tell you about all the reasons and how many people it'll touch. So I hope you'll come and do one of those
I
tours.
will. Side note, the BLTs at the hospital are actually really
Our
great.
food is fantastic. It really is.
It really
They
is.
do a pasta station on
I
Wednesdays. It's
know.
fantastic.
It really is.
Yeah.
I was just, whenever my friend Andrea, who's the ED at the Boys and Girls Club, that's actually like, her and I have similar tastes in food. And she had her daughter a couple months before I had my son, and she told me, she's like, the BLTs at the hospital are actually great.
They're fantastic.
And I can attest to that.
When I see a comment about bad food at the hospital, I'm like, go look. I bet they run a no sodium diet.
Yeah.
So they didn't get any salt.
Yeah,
so
they
it
were the
wasn't very
heart.
good.
One of the heart
Yes,
patients was
I'm
like,
sorry,
I can't
that's
have
not
salt.
our fault. That's your doctor ordered that diet for you. Yeah, our food's fantastic.
Well, thank you so much for coming.
Thanks for having
It was
me.
such a great
Yeah,
conversation.
I always love talking about the hospital and our team, and very proud of them. I'm very inspired every day and proud to work
As you
there.
should be. Well, thank you so much for listening and tuning in. If you have any questions about where to find information about the Midland Memorial Foundation to help support their new mission, or the hospital, check out the details within the caption of this post. Thanks and have a great day. Bye.